I'm Bev Turner. This is a GB News Originals. And today, a topic that I think is close to many of your hearts, but is not getting the attention that it deserves. That is the remarkable work taking place in America within the walls of Robert Kennedy's Department of Health and Human Services. Now, people who don't know what they're talking about will say, Bobby Kennedy, you mean the anti vax nutter? But you and I know that is precisely what you are supposed to think, so that big food and big pharma can continue to profit from poisoning us. So trust me, the Make America Healthy Again project is the most revolutionary department here in DC. And there are mini earthquakes happening in every single government office here. So that is no mean feat. I want to give you regular updates on GB News Originals so that you can see the policy changes being made here in the land of the mega fatty, and maybe we too can consider what our government could do to help save the NHS and the next generation of British kids who are so unfit that they are currently in line to be the first generation to die before their parents. Now, in America, the Health and Human Services Department is the giant umbrella that oversees everything from the Center for Disease Control to the Food and Drug Administration and to the National Institute of Health. It is vast, it is political, and it is deeply influential. A sprawling federal department responsible for healthcare policy, drug regulation, public health guidance, and the scientific institutions that drive medical research. In Britain, we've organised things in a very different way. So Public Health England had a rebranding in the pandemic, and under the cloak of darkness emerged as the UK Health Security Agencies, which is one of the most chilling renamings in history. What has health got anything to do with security? Unless, I don't know, you intend to spy on people to make sure they're taking the drugs that the state demands. Anyway, I digress. The UK HSA is narrower in scope than Bobby Kennedy's office here in America. And it focuses specifically on health protection, infectious diseases, emergency responses, and what the UK calls biosecurity. They say that they want to keep all our communities safe, save lives, and protect livelihoods. And they're slightly obsessed with things like, how is climate change affecting our mental health? I'm not even kidding. So while America's HHS controls the full ecosystem, which one might say is important given that healthy humans require a holistic approach, which includes diet, healthcare, exercise, and so on, not so much climate change, to be honest, the UK splits those issues into multiple agencies. So in practice, that means that America can coordinate multiple departments at the same time, while the UK operates a patchwork of institutions that might not only fail to work together, but could also actively work against each other for funding, etc. So let me give you just this week's announcements. This is just from this week from the Make America Healthy Again warriors, which hopefully will foreshadow debates heading our way in the UK. And as I give you these insights, I ask you to consider whether these Trump appointees are really the bad guys, or is that just what certain media outlets would like you to think? Firstly, the CDC appointed a new principal deputy director this week, Dr. Ralph Lee Abraham. He's a former US representative and Louisiana Surgeon General, and he's known in American politics for pushing back on what he calls the unscientific approach to the pandemic, particularly around mass vaccination mandates built on what he would say was false evidence. So Dr. Abraham has long championed informed consent on the part of the patient to any procedure, personal autonomy, an old-fashioned concept meaning your body, your choice, and a more measured approach to public health. Now, this appointment signals a significant change of tone at the CDC towards greater skepticism of one-size-fits-all public health solutions. And I say, hallelujah. The relatively new head of the NIH is Dr. Bhattacharya, who was headhunted from London to this top job. And he's responded to a critical piece about him in the New York Times this week. The article expressed concern that Bhattacharya wouldn't support lockdowns if another pandemic occurred, and his answer was quite clear. He said, and I quote, lockdowns were the biggest public health disaster in history, and it's true. I won't ever recommend one, as if I couldn't love him any more than I already do. Well, this marks a profound departure from the American public health establishment's orthodoxy and is so different to our own despicable COVID inquiry, saying that we needed to lock down harder, faster, sooner. They make us look like a joke. Bhattacharya is arguing for a healthcare system based on trust, very novel, gold standard science, and liberty. A return, you might say, to classical public health rather than emergency rule by political coercion. Meanwhile, Secretary Kennedy and Dr. Oz rolled out a raft of reforms for Medicare and Medicaid, which are hard to compare to the UK with our crumbling NHS. But in a nutshell, they include updates to a star rating system, the removal of pointless performance measures, and an emphasis on improving real world clinical care. But perhaps more significantly, they announced a 44% net saving, that's around $12 billion, on 15 high cost drugs, including cancer and chronic disease treatments. Kennedy said this is part of the administration's commitment to lowering drug prices, as President Trump had instructed his team to use, quote, every tool available to reduce costs for senior citizens. And for millions of Americans struggling with medical bills, these changes could be genuinely transformative. Now, the next one generated great excitement for those of us who want to see key lockdown and COVID vaccine pushes held to account. President Trump declaring that all Biden administration executive orders not signed directly by President Biden, but instead by his now famous auto pen, are invalidated. Now, this could mean that the Biden pardon of Dr. Anthony Fauci was invalid. I remind you, he is the bloke that many hold responsible for alleged acts of malfeasance in office during the COVID era and also before. So he could find himself in court. And I ask you, is there any sense of the British government wanting to even ask questions about the damaging lockdown policies, never mind seeing the architects of such self-harm behind bars? Unlike the UK, where we are told to just forget about the people who weren't allowed to say goodbye to their dying relatives or a generation of children who never caught up on their education, here in America, COVID era accountability remains a simmering issue in American politics, and the MAHA team are not letting it go. And finally, Dr. Vinay Prasad, he is the director of the FDA Center for Biologics Evaluation and Research, issued an internal memo explaining that an analysis of pediatric deaths reported to the Vaccine Adverse Event Reporting System, the VAERS system, of course, from 2021 to 2024, determined that at least 10 healthy children were causally linked to COVID-19 vaccines, likely through myocarditis, with the actual number potentially being much higher due to underreporting. So the memo highlighted that the elevated risks for boys and young men and proposed stricter regulatory standards, including pre-market randomized trials, enhanced scrutiny of vaccines given to pregnant women, and a re-evaluation of co-administering multiple vaccines in one go. And on the flu vaccines, Prasad described the framework under which they are distributed as, quote, an evidence-based catastrophe of low-quality evidence and uncertain vaccine effectiveness measured in case-controlled studies with poor methods, advocating for revisions to prioritize safety data and honest labeling. And crucially, he noted that the COVID vaccines do not show clear evidence of reducing transmission, unlike, he said, the MMR vaccines, which have long established population level benefits. So this is just 1 week. And if this memo reflects a broader shift inside the FDA, it could mark the beginning of a far more cautious vaccine policy in the US. So that was the last week of November in the world of MAHA. And these developments give us a glimpse of how America's public health establishment is revolutionizing and reevaluating everything, from lockdowns, vaccine policy, drug pricing, and even institutional transparency. So for those who felt unheard during the pandemic, this will look like long overdue reflection and consequences. Either way, the US is opening up a debate that Britain still has not properly had. What do we get right? What do we get wrong? How do we rebuild trust in public health critically? As ever, I will keep asking the questions that others avoid. I will bring you the facts, the context, and the debate that you deserve from this side of the Atlantic. Thank you for watching. I will try and do the same again on MAHA next week. I am Bev Turner. This was GB News Original. So please do like and subscribe below and download the GB News app from the App Store now and spread this everywhere so that more people can know what's going on here in America.